The vocal cords are found within the larynx. The false vocal cords are the upper pair of ligaments, so they're superior to the true vocal cords. The true vocal cords are the lower pair, and they are involved in sound production. The glottis is made up of true vocal cords and the space between them, so it's like an opening. The glottis is an opening. It actually opens into the trachea. So looking at the vocal cords here, the false vocal cords are shown, and the location of the true vocal cords is shown. And you can see when the glottis is open, how the true vocal cords look, in comparison to when it's closed. And then here's a photograph of that. Sound is produced when air vibrates. Air causes vibrations of those true vocal cords. The short, thin vocal cords produce a higher pitch, and the long, thick vocal cords produce a lower pitch. There's more to it, but that's pretty much the basics. So, the trachea is also called the windpipe. The trachea is supported by 15 to 20 C-shaped tracheal cartilages. The open parts of the C-shaped cartilages allow the passage of food along the esophagus. So you can see these are the cartilages, and then this is what they would look like. They have this open space in the back that allows for the expansion of the esophagus, okay, as you swallow food. Then we have the bronchi, because the trachea branches into the right and the left main bronchus. The right bronchus is larger and at a steeper angle, so it creates a more likely pathway for foreign objects to get trapped. So you're more likely to choke due to something blocking your right lung than your left. All right, then we have the lobar, the primary bronchi branch into the secondary bronchi or lobar bronchi. There are 2 secondary bronchi in the left lung because there's 2 lobes in the left lung, and then there are 3 in the right lung. Then we have the segmental bronchi or tertiary bronchi, and eventually the bronchi branch into the bronchioles, and the bronchioles don't have cartilage. They don't have those C-shaped cartilages. They have walls dominated by smooth muscles so that they can dilate and constrict in response to if the sympathetic nervous system activates the bronchioles, it will cause the muscles to relax, those smooth muscles to relax, and the bronchioles will dilate. This is called bronchodilation. And if it's the parasympathetic nervous system, that's going to cause the constriction of that smooth muscle. Contraction of that smooth muscle, and that will cause bronchoconstriction. And the reason is because when you're relaxed and under parasympathetic stimulation, the bronchioles don't need to be dilated. They because it's you're not really having to work hard to breathe. Looking at the branches, okay, so here's your trachea. This is the left primary bronchus, and it's branching into the secondary bronchi. There are 2 of those in the left lung, and then those branch into segmental bronchi or tertiary bronchi, and then the smaller bronchi branch into bronchioles, which, as you can see, don't contain cartilage, and then there's the terminal bronchiole, and then you have the respiratory bronchiole and the alveoli. Checkpoint question: what is the functional advantage of C-shaped cartilages in the tracheal wall over completely circular cartilages? And as we said, as we talked about, that allows for you to swallow food. It allows for the esophagus to expand. All right, the terminal bronchioles are the smallest conducting passageways, and they branch into the respiratory bronchioles. And the respiratory bronchioles lead into the alveolar ducts, and those alveolar ducts are connected to the alveoli. And they're kind of arranged like this with capillaries surrounding them. The alveolar ducts end at the alveolar sacs, and which contain multiple alveoli. You do need to know that each lung contains about 150 million alveoli, or air sacs. These air sacs give the lung a spongy appearance and vastly increase the surface area. The total surface area of both lungs together, if you were to spread out all of the tissue, is about 140 square meters. So this allows for a lot more gas exchange than if you didn't have all these, tiny alveoli. All right, the structure of an individual air sac or alveolus. First of all, you have cells called pneumocyte type 1 or type 1 alveolar cells, and they are usually, this is the most numerous ones, and they're usually simple squamous epithelial. This is simple squamous epithelial tissue. Let's go ahead and highlight. There's something about the ones and the twos and the font that these notes are done in, that the ones and the twos I have to highlight those as I'm going through the notes. I can't do it in the editing part. So anyway, so we have the pneumocyte type 1 cells. We have the alveolar macrophages, which are also called dust cells. They roam, and they're phagocytes. So they help in destroying pathogens. And then we have the pneumocyte type 2 cells that produce surfactant, and that surfactant is oily, helps to keep the alveoli open by reducing surface tension. When a baby is born, if they aren't producing surfactant, this triggers respiratory distress syndrome, which can be remedied by spraying surfactant, and then they can inhale it. So here you can see the microscopic, the way the alveoli look and the different cells that compose an alveolus. So as you can see, the majority of cells look like fried eggs. So those are simple squamous cells. They're the pneumocyte type 1 cells. And then you have the pneumocyte type 2 cells are here, and they produce surfactant. You have the alveolar macrophages, which are for, engulfing, phagocytizing germs and that kind of thing, and they're able to roam through the alveoli. All right, and all the alveoli are surrounded by blood capillaries. So it says, let's see, the title of this slide is the blood-air barrier of the alveoli. It's also called the respiratory membrane. And it's going to include the membrane of the capillary, the membrane of the alveolus, and then the basement membrane in between. There were it's actually two fused basement membranes. Because both the lining of the capillary, that's simple squamous epithelial tissue with a basement membrane, and the lining of the alveolus is also simple squamous with a basement membrane. So this is your respiratory membrane, and oxygen is going to move from here to here, and carbon dioxide is going to move from here to here. So that's kind of how the diffusion of gases occurs in the lungs. All right. The endothelial cells of the capillaries, in other words, those simple squamous epithelial cells, are the main source of angiotensin converting enzyme, or ACE. In other words, they're going to help activate the angiotensin system, which will help maintain blood volume and pressure. We talked about how angiotensin functions, and and it just helps to, angiotensin is going to help to maintain blood pressure. So you see that in the kidneys, and now we're seeing the same kind of thing in the respiratory system. Let's see, pulmonary embolisms occur when blood pressure in the pulmonary blood circuit is low. A pulmonary embolism is a blockage of a branch of the pulmonary artery. So it's a blockage in a pulmonary artery. I'm sorry, I just want to explain this a little bit better. So what this is saying is blood pressure in the pulmonary circuit is typically low. That's just normal condition for it. So an embolism is a blockage of a pulmonary artery, and it's caused by drifting masses of fat, clots, and air bubbles in the blood. Embolisms are likely to occur here since the lungs receive the entire cardiac output, and they're very dangerous, of course. The lungs are divided into the left and the right lung. The left lung has 2 lobes and the right lung has 3. I think we mentioned that, and here you can see right lung has 3 lobes, left lung has 2. As far as the serous membranes that surround the lungs, they are called the pleura. The visceral pleura actually covers the surface of the lungs, and the parietal pleura lines the inside of the chest wall and the diaphragm. And in between those 2 layers are the pleural fluid. So if you look at this diagram of the lungs, you can see here's your visceral pleura that actually forms the surface of the lungs. Then you have pleural fluid in between, and then you have the parietal pleura here. All right, a pneumothorax occurs when the parietal pleura is punctured or the alveoli are damaged in an injury. What happens is, like if you're stabbed or if you're in a car wreck, air enters the pleural cavity, and the fluid between the 2 layers is the fluid bond is broken. So the lungs could collapse. So lung collapse is also known as atelectasis. And treatment of a pneumothorax or lung collapse involves removing the air and sealing the opening. Also, sometimes you can have blood in the pleural cavity. That's called a hemothorax. That can happen from the same type of injury. Okay. There we go. Trace the path air takes in flowing from the glottis to the blood-air barrier. All right, so we can just go back to a picture there. I think it's good. What I try to do with those checkpoint questions is I try to ask questions that, let's find a good picture. Apply what we just learned and don't just ask you to repeat, here we go. This is good. But I think it's good to review this material. So from the glottis, here's the location of the larynx. So the glottis is located in that same area. So the epiglottis covers over the opening to the larynx, which is the glottis. So air is going to flow past into the trachea, and then into the primary bronchi, the secondary bronchi, the tertiary bronchi. And then those larger bronchi are eventually going to branch into bronchioles. The last bronchiole before you get to the respiratory bronchioles, the last bronchiole is called the terminal bronchiole. And then that becomes the respiratory bronchioles, which are actually attached to the alveolar sacs and the alveoli themselves. All right, so sorry. Okay, so now we need to talk about internal respiration versus external respiration. Breathing is ventilation. So external and internal respiration involve gas exchange. Okay. External occurs in the lungs. Internal occurs at the level of the tissues. So external respiration is defined as the exchange of oxygen and carbon dioxide between the body fluids, which is our capillaries, and the external environment, and that would be our alveoli. So between the alveoli and the capillaries is external. And then between the capillaries and the body cells or tissue cells, that is internal respiration. So here are 3 steps of what we call external respiration. We have pulmonary ventilation or breathing, and that gets air into and out of our lungs. That's just inhaling and exhaling, which we will also call inspiration and expiration. And then there's gas diffusion at 2 sites. Across the respiratory membrane, which is the where the capillary meets with the alveoli, and then across the walls between the capillaries and the body tissues. So really what we refer to as external respiration occurs in the lungs. So it's this part right here, the part between the blood and the alveoli. So I'm thinking that we need to do this. I think here we're going to make a little bit of a change. Instead of calling that external, we're going to call it just respiration. I think it's probably a mistake. Okay. All right. And so external is where is the exchange of gases between the blood capillaries and the alveoli, and then internal respiration is exchange between the capillaries and the tissue cells. And then we also have the transport of oxygen and carbon dioxide, it says between the alveolar capillaries and capillaries and other tissues. So this is just the transport in through the blood of these 2 gases, and oxygen mostly is transported by being attached to hemoglobin. So this is slide number 45, and we will go on with this in the next recording.